Hi, team. Dr. Rachel here. With the holiday season upon us, many people have questions about how to stay consistent with their GLP-1 compound medications and maintain their wellness goals. Today, I'll be answering some of the most common questions I've received to help you enjoy the season while staying on track. All right, let's get started about some questions about weight management. The first question is, what is weight management? Well, weight management at Restore is a customized treatment plan under the Performance Medicine Program. The Restore Weight Management Program is an effective, evidence based plan developed with our Chief Medical Officer. Our personalized medicated weight loss track within our Performance Medicine Program combines GLP-1 compounded medications with clinical guidance from our NPs and your unique health data with science-backed therapies. So then the next question is, well, what is performance medicine? Performance medicine at Restore is our newest comprehensive membership. Performance medicine personalizes your wellness journey by focusing on the immediate and actionable imperative of improving and maintaining your physical and mental health. The Performance Medicine Program incorporates an individualized combination and ongoing monitoring and clinical support. The unique value of the Performance Medicine membership is that you get personalized diagnostic insights into your performance. Your wellness journey includes a comprehensive biomarker panel and ongoing body composition monitoring with our research-grade in-body machines. This goes alongside ongoing clinical and coaching support from our highly credentialed nurse practitioners. Every step of your wellness plan in the Performance Medicine Program is curated for you and your goals. So let's talk about this impending holiday season. A question that I've gotten is, how can I manage holiday cravings and larger meals while on GLP-1 compounded medications? And will these medications help me make better and healthier choices? Well, GLP-1s can play a helpful role in moderating appetite, which may naturally lead to healthier choices. However, planning ahead is key. Try choosing smaller portions or loading up on vegetables and lean proteins first. The medications are a great support, but conscious choices will always help to maximize your progress. The next question I have is, what do I do if I miss a dose during travel or holiday gatherings? Are there specific guidelines for adjusting my schedule? Now, most GLP-1 compound medications have some flexibility in timing, but it is essential to get back on schedule as soon as you can. If you're uncertain, you can reach out to your healthcare provider for guidance on when to resume to ensure consistency and to avoid any potential side effects. The next question is it okay to enjoy holiday treats, or will that interfere with my progress on GLP-1 therapies? Now, if you know me, you know I believe life must have joy, and food is a big part of that. So enjoying a treat or two, absolutely. It is perfectly okay to indulge a little during the holidays. And GLP-1 compounded medications are actually meant to assist you in managing your health, not to restrict you. The key, as always, is balance. Enjoying those holiday treats mindfully can help you feel satisfied without feeling restricted and without impacting your overall progress. The next question is about managing appetite. Somebody asked, I've noticed some changes in my appetite since starting GLP-1s. How can I handle holiday meals without feeling uncomfortable or overly full? This is a great question because many clients do notice that their appetite changes on the GLP-1 compounded medications. And it's very common to feel full faster. So the key is at these big holiday meals, take smaller portions of each of the foods that you're excited about And then try to eat slowly and listen to your body's signals to prevent discomfort. You can always save a little bit of leftovers to enjoy later without the pressure to finish everything once. Now, another question that I got that's really great is, are there any special tips or tricks for managing weight and wellness goals with the GLP-1 compounded medications during a season that is full of indulgences? Now, remember, I just said life must have joy, and you do want to mindfully indulge. But sticking to your wellness goals throughout that holiday season is certainly also possible. Remember some of the other behaviors that are so critically important. Stay hydrated, get enough sleep. Consider a simple plan for balanced meals outside of those rich festive gatherings that you might have. And when you do, focus on those protein and fiber full veggies in order to stay full and energized. Also, a really great trick is to move a little each day. Exercise is so important, even if it's just a walk outside to take some deep breaths. This can really help you feel your best. Question that I got is about counting macronutrients and managing a calorie deficit during the holidays. The person asked, should they be counting their macros and calories? And should they be doing it regularly? And how do I do this during the holidays? Because it's so hard to keep up with what veggies and fiber and fruit and protein I eat when I'm constantly out with friends or at events. And what I would say in general is that counting macronutrients and maintaining a calorie deficit can be challenging no matter what time of year it is, but especially so with all of these holiday foods around. So, my advice is, rather than really thinking about the numbers themselves, focus on balanced meals. Again, aim for enough protein, fiber, and healthy fats to stay full, and prioritize those whole foods, especially colorful vegetables, as the backdrop of your meals. This will naturally help to keep your intake in check and also provide all of those really essential nutrients that you need. And remember, consistency over time is really more important than perfection during a festive meal. So now that we've covered some of the GLP-1 compound medications and how they can support your wellness goals during this holiday time of indulgence and celebration, I want to pivot a little bit to some more general therapies, because we know that wellness isn't just one aspect. It is based on a holistic journey. So let's broaden our focus a little bit to answer some of your more general health and wellness questions. The first one comes back to our GLP-1 therapies, and they ask specifically, what's the difference between the compounded GLP-1 medications and the name brand drugs? This is an important question that many people ask about these different therapies. Compounded medications are custom formulated, often to suit individual needs, while brand name options follow a fixed formula. Both have their benefits, but it's best to discuss with your provider which choice is right for you. Another question is, what if you have been taking these GLP-1 medications and you have something like a surgery coming up, maybe like a surgery on your arm? So the answer is, if you're scheduled for a surgery, for something that potentially is not related to your digestive tract, like a surgery on your arm, you'll likely need to pause your GLP-1 compound medication temporarily. However, the final say is going to be by your medical care team. So always consult your surgeon and the healthcare providers that you are working with for guidance, as they will have very specific instructions based upon your individual procedures.